Methadone is an opioid medication that's most commonly known for treatment of opioid use disorder or people who get into difficulty with opioid addiction. It's also used for acute and chronic forms of pain. But it actually is one of the most commonly prescribed opioids for restless leg syndrome over the past 20 or 30 years. But the dosing of methadone is much different for restless leg syndrome than for other conditions for which it is used. I'm Dr. Andy Burkowski of ReLACS Health. This week's video, we're going to talk about how to dose methadone for restless leg syndrome. So, opioids are considered a consensus second-line treatment for moderate to severe restless leg syndrome. In fact, they're the oldest treatment perhaps for restless leg syndrome, dating back to the opium plant that was used in the 17th century for this condition. Now, the vast majority of people with restless leg syndrome would not need to use opioids, so this does not apply to most people. But those with moderate to severe restless leg syndrome, in whom first and second line treatments have not been effective or tolerated, this is a legitimate treatment option despite the backlash of the medical community against opioids in general. Because methadone and other opioids have risks, I generally advocate now for the use of buprenorphine, as I've spoken about elsewhere, as the first opioid to be used in most patients with restless leg syndrome. But if buprenorphine is not tolerated or not effective for whatever reason, methadone probably is the next best choice. Methadone has its advantages. It has some anti-NMDA effects that may also be beneficial to restless leg syndrome, in addition to the opioid effects that help with restless legs. Now, methadone is a long-acting drug. So what does that mean? Well, methadone has a wide variety of range in which, after you take it, it may last in your system a very long time. So it could be anywhere from about 50% of it can last about a half day to as much as 2 days or more. So the average is roughly around a day or so for your body to get rid of 50% of the methadone you take. This is called the half-life elimination. That means if you take 5 milligrams of methadone on Monday, you could still have 2.5 milligrams in your system on Tuesday and maybe 1 milligram on Wednesday. So the drug could build up in the body. So the effect may be greater later on over the course of the week. So that's why it's important for doctors and patients not to be increasing the dose of methadone too quickly. Methadone strength is measured by morphine equivalents like many opioids, and 1 milligram of methadone at low doses is the equivalent of 4 milligrams of morphine. So it's a pretty strong drug. So the formulations that are available in the US are 5 and 10 milligrams, sometimes 40 milligrams. But for people with restless leg syndrome, they're probably going to start on a 5 milligram tablet. But I wouldn't recommend even starting with 5 milligrams, probably 2.5 milligrams to individuals who haven't been exposed or have developed a tolerance to opioids. So 2.5 milligrams is roughly 10 morphine equivalents. So that's a pretty strong dose, even at half of the lowest available dose. Now, one trick is there is a methadone solution that's 5 milligrams per 5 milliliters. And if even 2.5 milligrams is maybe too strong, a doctor can prescribe the solution, and an individual can take very finite doses, such as 1 milliliter, which would be 1 milligram, or 2 milliliters, which is 2 milligrams. In my clinical practice, I've had patients on 2.2 milligrams or 9 milligrams using this oral solution to get a very accurate dose. So when methadone is taken, it usually takes an effect within 30 to 60 minutes. So for restless leg syndrome, when the condition is mostly affecting people at night, it's usually once a night is sufficient, sometimes twice a day in some patients. But it needs to get into the system 1 or 2 hours before the symptoms start to take place, and it could take its effect at that time. And after administration of the methadone, it could, as I mentioned, last 1 or 2 days, and the system starts to build up. So roughly around 5 days for some individuals, that's when you know that that daily dose is the correct one. So only after 5 days would I recommend going up. So if starting at 2.5, that's not effective after 5 days, but with no side effects or tolerable side effects, go up to 5 milligrams after 5 days. So increasing the dose every 5 days or more or longer would be the recommended amount because of that long amount. Typically, most patients with moderate to severe restless leg syndrome need anywhere between 2.5 and 10 milligrams of methadone. So people starting on 15, 20, 30 milligrams for other conditions, including pain conditions, that's usually way too much for people with restless leg syndrome. So keep that in mind. If you're starting on a very high dose, it could cause tremendous side effects to somebody who's not adapted to taking opioids, which would be the majority of people with restless leg syndrome who have been using other medications previously. So this is the kind of the range, but there are individuals who may need it 2 or 3 times per day, or even up to 10 or 15 milligrams, which could be up to 60 milligram morphine equivalents. Again, this is all personal to the individual, but this is just a rough range of where one would expect it to be. This is not going to be people taking it for opioid use disorder where they might be taking 80 milligrams twice a day, which is hundreds of morphine equivalents. But this is a very, very low dose and extremely effective at very low doses, which can help to mitigate some of the side effects in those with restless leg syndrome. So dosage is very important. This is a very personalized medication requiring personalized treatment. So it should also, patients should be aware of the risks of this medication, but also know that it should be under the guidance of a licensed medical provider who can help guide patients to starting and monitoring for this complex but necessary medication for some people with restless legs syndrome. As always, as I just mentioned, this is not personalized medical advice. This is general medical information only. Treatment of restless leg syndrome medications should all be done under the guidance of a licensed medical professional. And as always, one of the keys to sleeping well is to relax.